Hi, everybody. Welcome to Alliance Medical Ministry. Thank you, Governor Stein, for being here and choosing this location for such an important conference. I'm Pete Tannenbaum. I'm Executive Director of Alliance Medical Ministry. We are a free and charitable clinic serving uninsured working adults right here in Wake County. Our patients fall into a dangerous gap. They don't qualify for Medicaid. They can't afford private insurance. Every doctor visit here, every counseling session here is funded by community philanthropy. So here's why proposed Medicaid cuts are so concerning to us. Alliance is one of the few clinics in North Carolina's healthcare safety net that doesn't take Medicaid. So we're bracing for a surge of newly uninsured patients with nowhere else to turn. The healthcare safety net, including all the free and charitable clinics across North Carolina, is worried about the potential unwinding of Medicaid expansion and folks exiting the ACA due to loss of subsidies, making the marketplace unaffordable, resulting possibly 700,000 North Carolinians losing their health care. Most of our patients live with 2 or more chronic diseases: diabetes, hypertension, obesity. When they can see a primary care provider, they manage these conditions, they stay healthy, they keep working, and they care for their families. But without routine care, small problems become emergencies. Patients wait until they're dangerously ill, wind up in the ER, needlessly sicker and far more expensive to treat. The downstream financial impact of this crisis will hit clinics like ours and hospitals very hard. Last year alone, North Carolina's free and charitable clinics saved hospitals across the state $350 million in avoided ER costs and provided $260 million in care value for our state's most vulnerable citizens. Medicaid cuts will erase these savings, drive costs through the roof, and put our neighbors' health at risk. This is not just a financial crisis, it's a human crisis. These are our neighbors, our friends, and members of the community that we see every day, we work with, they take care of our children, our parents, and they have concerning health care issues. Thank you.
Thank you. Good afternoon. My name is Jenna Beckham. I'm a board-certified OBGYN working here in Wake County. Thank you, Governor Stein, for hosting this important conversation, and to the staff and providers here at Alliance Medical Ministry, which provides such essential care to our community, as we just heard. As an OBGYN, I care for patients across their lifespan and in some of the most critical moments of their lives, from pregnancy and childbirth, and including preventive care and management of many chronic illnesses and diseases. Medicaid funding is essential for ensuring access to these services for my patients and their families across the state of North Carolina. Without additional funding, our provider reimbursement rates are set to be cut starting October 1st. These cuts could force many physicians to leave the Medicaid program, which would make it harder for patients to find care when they need it most. If providers exit the Medicaid program, patients will lose access to these things I just mentioned that are so essential: routine exams, prenatal care, cancer screenings, and other essential services. This will lead to longer wait times, delayed diagnoses, and worse health outcomes for the patients of our state, especially for those who live in rural communities and who are already marginalized and underserved. The impact will be most severe for many patients who have complex medical needs, high-risk pregnancies, and our most vulnerable children. Those who are already facing barriers to care will be hit the hardest. Healthcare access should not depend on a person's income or insurance status. As our prior speaker said, this is a human issue and a basic human right. The North Carolina General Assembly must act now. The House and Senate need to return to the table and pass the necessary Medicaid funding to protect access to this care. This crisis is a direct result of failure to appropriate the funding that providers and our patients need. Put the health of our communities first is my ask, and hopefully they can work together to pass funding so that every North Carolinian can access the care that they need and deserve.
Good afternoon. My name is Chelsea Gray, and I'm the mom of 3 children. For many parents and caregivers in North Carolina like me, Medicaid is the resource that helps our children grow up to be happy, healthy, and ready for the future. As of January of this year, Medicaid serves more than 1.4 million children across this state. More than 500,000 of these children have special health care needs. 49% of these children rely on Medicaid coverage. Medicaid makes it possible for them to thrive by helping access to therapies, treatments, support services, and their prescriptions that they need to live a healthy life. My daughter, Molly, is living with a medicine-resistant, surgery-resistant, non-curable epilepsy that causes her to have around 191 seizures a day. Every single day, we manage unpredictable seizures, navigate limited treatment options with already slammed doctors, and face a future that feels incredibly uncertain. In a time when it is already difficult to find individuals who are willing to tough this out and do the essential work, I worry about how much more difficult it will to find care for my child and all of the children in this state if Medicaid funding is not protected and provider cuts are put into place. Everyone directly involved with caring for our children, my child who has a disability, is facing a potential cut. This is not just doctors, it is the home nursing staff. It is also their therapies, their case managers, their OT, their PT, and every single person who makes my child's life happy and healthy. To put this in perspective, as I said, my daughter has 191 seizures a day, and it is tracked by a medical device. Yet, some of the appointment times for her specialists are 4 to 11 months currently. Some of her specialists all of her specialists are facing reductions in their current funding, and it will force some of her doctors and other professionals to stop accepting Medicaid altogether, while receiving an overwhelming influx of new patients who are looking for care. The result will be delays in life-saving care for people like my Molly across the state, as well as incredible, unnecessary trauma for families and caregivers statewide. Treating families with disabilities and the people who care for them at every level should be a basic and fundamental expression of human and community care. I am here today to share my story, but not just for my family or my daughter, because we will be affected. It is for every child and every parent in our state. The decisions made here will impact hundreds of thousands of families like mine, families who are simply just trying to keep our children alive and happy. And I fully believe everyone in this room would do the exact same thing. As a parent of a child with complex health needs, every day is already uncertain. It's hard enough to keep them alive and happy. We are barely staying afloat with the funds that Medicaid currently has. So I encourage our lawmakers, and I'm pleading with our lawmakers, to take whatever action is necessary to sustain Medicaid and to relieve the uncertainty that we are facing. I need your support and all of our lawmakers' support to ensure that all of our children are cared for, protected, and able to access the services that they need and deserve. Thank you for your time, and it is my honor and privilege to introduce Governor of the great state of North Carolina, Josh Stein. Thank you for listening.
Goodness. Good afternoon, everybody. I want to thank you all for talking about an issue that is urgent to the quality of care for people's health across the state. I want to thank Pete Tannenbaum and Alliance Medical Ministry for hosting us and for the important work you do in our community to care for people in great need. I want to thank Dr. Jenna Beckham for the work that she does and her willingness to come forward and explain the real consequences of the legislature's failure to act. And most importantly, I want to thank Chelsea Gray. It's not easy to come up here and talk about your daughter's medical needs and put it all out there for the entire state to watch, but her passion for her children and her passion for other children demands that she do so, and I'm incredibly impressed and grateful. Thank you. I want to lay out where we are right now. everyone, the Department of Health and Human Services, and I'm joined by Jay Ludlam, who directs the state's Medicaid program, Health and Human Services, the state Senate, and the state House all agree that there is not enough funding to maintain the level of Medicaid that we and our people deserve. Everyone agrees that we need to put more money into the program to avoid cuts to provider rates or medical services to beneficiaries. When I say beneficiaries, I'm talking about people all across the state. The House and the Senate each determined that we need $190 million more to keep Medicaid going at its current rate. That's based on an analysis by the Fiscal Research Division of the General Assembly. In fact, each chamber passed a bill this week that would do just that, put $190 million more into the Medicaid system. Even though actuaries and economists at the Department of Health and Human Services have concluded that more than 190 is needed, in fact their number is 319 million, they have found a way to delay any cuts if the legislature will add this crucial $190 million to their budget. The legislative proposals were an encouraging development. I had hope over the weekend that I would have good news and I could issue unfettered praise to the legislature here today. But this week, they did not get it done. They put their political disputes ahead of our people's health. And what's crazy is that their disagreements have nothing to do with Medicaid. It's hard for me to express the gravity of their failure. And I want to speak directly to the people of North Carolina, to the providers who care for Medicaid patients, and for anyone who's concerned about the state of our healthcare system. The General Assembly has failed you, but it is not too late for them to step up and do the right thing. I'd hoped that the legislature would realize that helping people get the health care they need is more important than grinding their political axes. But so far they haven't, and I refuse to give up. I will keep pushing to reverse the damage that will be done. I'm using every tool at my disposal to ask for the money, to look for the money, to demand the money that we need to keep our state's healthcare system safe. Money like the $500 million that is in the Medicaid contingency reserve account that is available for the legislature to appropriate today. Until we see movement from the General Assembly, however, here's the unfortunate situation we are in. On October 1st, Medicaid cuts to providers' reimbursement rates will go into effect. This is precisely the situation we were desperate to avoid, that we've been warning them about since May, in meetings, in emails, in-person briefings, letters, conversations, and press conferences over and over until we were blue in the face. Specifically, we are gravely concerned that the cuts to provider reimbursement rates could lead to healthcare providers leaving the Medicaid program completely. That's exactly what Dr. Beckham was talking about, and the consequence would flow straight to Alliance Medical Ministry. If those providers leave Medicaid, many patients will not have access to health care, and there may simply not be enough other providers to pick them up, so that you then have situations where folks are waiting for an appointment for 4, 5, 6, 7, 8 months just to see a specialist. Some have said that DHS can avoid instituting these cuts, or that DHHS can delay the cuts. Unfortunately, it cannot. The state constitution requires the state to have a balanced budget. DHHS cannot spend money that it does not have. It cannot put health care costs on a credit card. It cannot spend at a rate that we know is unsustainable due to increased utilization and due to rising health care costs. If you at home experience a pay cut, you cannot keep your old budget. You may have to make cuts to your own budget even when they're painful. So because the General Assembly has failed to appropriate to the Department of Health and Human Services any funding more this week, these cuts to Medicaid will unfortunately go into effect next week. The one piece of hopeful news is this, that it is not too late for the General Assembly to fix the problem it has created. I'm urgently calling upon the legislature to come back to the table. These cuts can be reversed. Since we've known about this circumstance, I directed DHHS and Medicaid to identify cuts that were reversible. What does that mean? It means that our representatives and senators can come together on a deal, undo these cuts in the month of October. So that's my request, that the House and the Senate come together, put your differences aside, and put the patients, the providers, and the healthcare system of North Carolina ahead of your petty political disputes. Remember what we all agree on. And when I say all, I'm talking about the House, the Senate, and my administration. We all agree that Medicaid needs more money. We all agree that none of us want these cuts to go into effect. We all agree that we want to protect people's health care. I cannot emphasize this enough. These cuts are reversible if the legislature comes back and does the right thing. I know the House and the Senate can work together. I know the General Assembly and my administration can work together. Just this week, we worked together to reduce wait times at the DMV and to invest in recovery after Tropical Storm Chantal. We've worked together to help the people of Western North Carolina recover from Hurricane Helene. We've worked together on critical economic development programs and projects that will create good paying jobs all across this state. Let's work together again. Let's put our people's health first. Let's get it done. I am ready to sign a clean Medicaid funding bill today. Thank you, and happy to take some questions. You can address questions to any of the speakers. Yes, Gary.
Governor, in the past, there's been variances between, spending in Medicaid and what money is taking in. And legislature has said this week, at least Republicans, that this is unprecedented and that it's not necessary. Could you address that? They say that you folks have done this in the past and could work with what you have right now until there's an agreement.
Yeah, and happy to have Jay come forward and offer any more comment if he would like. But here's what's different. The legislature has not fully funded Medicaid in 6 or 7 years. Every year there's a shortfall. But what is different about this year is that there is no federal source of funds to make up the difference. We have a Washington, D.C. that instead of giving funds to help us provide health care to our people, have cut $1 trillion from Medicaid in order to finance tax giveaways to billionaires. So we live in a completely different fiscal environment with the federal government than we have in the past. So we cannot look to Washington to save us. We must save ourselves. Jay, is there anything else you'd like to add on that?
Good afternoon. Jade Ludlam, Deputy Secretary for North Carolina Medicaid. What I would add is that this pressure, as the governor stated, has been on the Medicaid program. This past fiscal year, last year that ended on June 30th, the Medicaid program ended the year with $9,000 in its account. That is after spending $34 billion. That is too close of a call for this big of a program. And so, like the governor said, we would welcome further appropriations from the General Assembly, and we do not anticipate any more federal funds. Thank you.
Governor Stein,
Yes.
The debate that we're hearing from the Senate and the House, of course, is the funding over the Children's Hospital that the House doesn't want to fund. Do you think that the House should fulfill that promise that they made back in 2023, or do you think these should be separate bills so that we can get Medicaid done?
I think what we should focus on is what we agree on. What we agree on is that Medicaid needs more money. We agree that if we don't get that more money, then we're going to be facing cuts to this program that are going to have devastating consequences to people's health across the state. So let's focus on that rather than the disagreements. I mean, what's interesting is when you look at the broader budget debate, by the way, we're one of only 2 states in this country that don't have a budget yet. We're the only state in the country that doesn't have a budget where both chambers are controlled by the same party. You have disputes between what is the appropriate trigger on future tax cuts, not whether we get rid of tax cuts, but what's the right trigger on whether to institute them based on a worsening economic climate, a much harsher federal fiscal climate, and then you have the Children's Hospital. What's funny is I think the Senate's right on the Children's Hospital. I think the House is right on the tax triggers. So I could resolve this thing immediately on the budget. But those are fights that need to be had another day. People in this state are going to suffer because of their inability to get the job done. That is unacceptable.
Governor Stein, Speaker Hall says you have the ability to delay this deadline. So why not push the deadline back?
The budget started on July 1. We were, at that point, $819 million short for the program. They had the mini budget that passed in July and gave us another $500 million, meaning that we're $319 million short. We put off the cuts for a full quarter of this fiscal year. We did not institute these cuts in July, in August, or September because we knew they were coming back in September. We were as clear as a ringing bell that this was their moment to solve this problem. And we could put the cuts off till October, although by putting them off to October, you're having to find these savings, this $319 million, over a 9-month period of time instead of a 12-month period of time, which means that the cuts have to be even greater. So now they're saying, well, just delay the cuts further. That will just increase the pain because the same amount of money is still going to be needed to address the shortfall. They've had the opportunity to solve this repeatedly. This was their moment. We could not have been clearer. They had to solve this in September. They chose to put their political differences ahead of our people's health.
Governor, you talked about bipartisan bills with Chantal. One bipartisan bill that I know you're reviewing is the crime bill in Charlotte. What's holding you back from being a yes, I'll sign this bill specifically? And would you be concerned about any possible veto overrides given there's 17 House Dems that backed it?
Yeah, at this point, I'm studying that bill and will continue to study that bill, and will make my decision next week. What is urgent today is the fact that on October 1st, providers across the state are going to see significant cuts in how much they get to cover to treat somebody who's on Medicaid. Some of those providers are going to say, you know what, it ain't worth it. That means there are going to be fewer providers to provide the care that is desperately needed across the state. That is what is urgent today.
And on Medicaid, you had said it's possible to push this. The lawmakers are coming back October 20th. They say at least they're coming back. Why not push it from October 1st to October 20th? Why not push it back 3 weeks?
Well, because we've pushed it back 3 months. And by identifying cuts that are reversible, they can solve this problem at any point up until October 20th. I would welcome them to come back and solve it next week. What I fear is that on October 20th, they'll do exactly what they did on September 25th. And if we put the cuts off for a month, then they're going to say, put it off for another month, because we're actually coming back in November. Then you only have 7 months to make up these cuts instead of 9 months. Like I said, we've already done this. We played this game. On July 1, we did not institute these cuts, even though we knew we didn't have enough money. We hoped that they would fund that rebase, and they gave us a partial funding, for which we were grateful in July, but we said then it's not enough. But we said we will hold off on those cuts. We won't institute them in August. We won't institute them in September. We'll wait till October, because you're going to come back and you can solve this, because they told us then not to institute the cuts. And here we are. It's time for them to step up and do the right thing for people.
Last question.
Governor, we're the anniversary of Helene, another tropical storm building off the coast. What are you doing to prepare for this? What should the people of North Carolina know about the storm that's building up?
Yeah, well, the team at Emergency Management, our team at the National Guard, they are constantly vigilant. They are very much tracking the storm to find out what the odds are of it forming and hitting North Carolina. When necessary, if necessary, they'll pre-position assets, whether it's National Guard. They'll work with local government and their emergency management to make sure that we're as prepared as we possibly can be. And I'm glad you mentioned Hurricane Helene, because Saturday is the 1-year milestone date of that storm. And we're still having a lot of work to do in Western North Carolina. The people out there are tremendous. The way that they work so hard for themselves and for each other is inspirational. It's an incredible demonstration of resilience and grit, and what we, as everybody else, but we as a state government and we as a federal government have to do is to meet their level of urgency and make sure that they have the resources they need to fully recover. I'm committed to doing that. I've been grateful for my partnership with the General Assembly, over $1 billion this year in 2 appropriations bills. We really need the federal government's help. I have an appropriation request of $13.5 billion before them to help us get what we need so people can be back in their homes, businesses can reopen, water systems, roads can be rebuilt. We've got a lot of work still to do. Thank you all for being here.
All right, thank you, everybody.